Welcome to Capital Diversity and Inclusion Consultants' introductory presentation on healthcare. We believe that healthcare should be a basic human right here in America as it is in most other developed nations. Adequate and proper healthcare is not available to a large number of Blacks, Hispanics, immigrants, women, and LGBTQ communities who are denied the services they need even with insurance coverage. And that is why today we will be looking at healthcare as a social justice issue. World Health Organization defines universal healthcare, or UHC, as meaning that all individuals and communities receive the health services they need without suffering financial hardship. It includes a full spectrum of essential quality health services, from health promotion to prevention, treatment, rehabilitation, and palliative care across the life course. Universal health coverage ensures universal access to health services that are of high quality, and that receiving health services does not put people at risk of financial harm. A universal health care coverage would guarantee that no person, regardless of income, age, gender, race, or location, would have to decide between medical care and food or shelter. Health care was deemed a global human right in 1948. We are still struggling to accomplish this. The first thing we need to know about healthcare in America is that we are the only developed nation in the world that does not have a universal healthcare system for its citizens. This is primarily because a specific group of politicians have decided that such a basic human right is welfare and socialism, and therefore not something they want to endorse. Those politicians believe that a person should only have access to what they can afford, not to what they need, even though they themselves benefit from the best health care available at the American citizens' expense and not their own. On this map, the countries in green have free and universal health care for all. Ghana, the lone bright green spot on the map, provides a system of universal health care to all, but it is not free. The ones in blue have free but not universal health care, and these are usually based on income and provide varying levels of coverage. The ones in red offer no universal or free health care to the public, with very few exceptions. The United States is still without a system of universal health care despite public demand. Even in nations with vast regions of poverty like India, China, and South Africa, there is still free health care available. The United Arab Emirates provides for its citizens, but not for foreign workers living in country. While free and universal health care coverage for every person on Earth is the ultimate goal, even in countries that do offer it, it is often a moot point because those who need medical attention have no local access. In some places, the closest clinic or hospital can be over 500 miles away. The green map indicates the countries that had universal health care in 2011. The red map indicates those who have it in 2021. I just added this to show that there has been an increase in universal coverage in multiple nations over the last decade, but the U.S. is still not making progress. While we do not have a universal healthcare system, President Obama brought us closer with the Affordable Care Act, or Obamacare. Let's look at the timeline over the last 10 years. In 2011, the Affordable Care Act was introduced and increased healthcare access to 27 million people in its first year. That year, the U.S. was ranked number 1 in wealth based on GDP. In 2016, the Affordable Care Act has helped ensure that 91% of all people in America have health care. 2017, Trump takes office. Through executive order, he increases share of cost, raises income limits, restricts access to immigrants, to LGBTQ individuals, and to women's reproductive care. In 2019, the U.S. falls to 11th in global ranking of wealth based on GDP after 2 years of the Trump presidency, and 60 million people are now uninsured. COVID-19 is first found in China. In 2020, the virus reaches the U.S. Trump politicizes it, calls it a Democratic hoax, and denies reality. He suggests non-scientific and potentially fatal solutions. He completely ignores World Health Organization and Center for Disease Control mandates. COVID-19 becomes a global pandemic. 2021. Joe Biden becomes president. The pandemic is taken seriously, and the U.S. begins recovering. The Affordable Care Act is reinstated and improved, and coverage protections are extended to the LGBTQ community and to women. Biden also returns the U.S. to participate in the World Health Organization, mandates wearing masks, and sees to vaccine distribution. The U.S. is now in decline of both deaths and number of new cases. As an added bonus, the U.S. is now, after only 4 short months, in a position to help other nations by sharing equipment, technology, and vaccines with them. The U.S. is once again becoming the leader in humanitarian relief and is saving lives. Biden's goal is to see that at least 75% of all people are vaccinated. That's the number needed to reach herd immunity by 200 days in office. We are on track to reach vaccinated herd immunity by the end of summer if people continue getting vaccines. As of the making of this presentation, 284 million doses of vaccine have been administered, and 129 million people are fully vaccinated, and the rate continues to increase at an average of 1.2 million people per day. Why is healthcare a social justice issue? Because the gross disparities in access are very real and put lives at risk every single day. I chose this topic because of the damage caused by the removal of healthcare mandates, the deaths caused by COVID-19, the restrictions placed on medical professionals treating LGBTQ and women, and the ongoing differences in infant mortality rates among racial, ethnic, and immigration groups in the U.S. and around the world. According to the Kaiser Family Foundation for Medical and Healthcare Research, health and healthcare disparities refer to differences in health and healthcare between groups that are closely linked with social, economic, or environmental disadvantages. Disparities occur across many dimensions, including race, ethnicity, socioeconomic status, age, location, gender, disability status, and sexual orientation. When measuring disparities, one of the metrics we use is infant mortality rates, IMR. The first chart shows IMR comparisons by country. The U.S. has the highest IMR of the 12 wealthiest countries. That means we have the highest infant death rate. Neonatal in this chart refers to birth to 27 days, and postnatal refers to anything 28 days and beyond. We are nearly twice as high as the global average and almost 4 times that of Japan. The second graph shows the infant mortality rate by race of the mother. Black infant mortality rate is nearly 3 times that of white infant mortality rates, and American Indian rates are 2 times as high. Asian mothers have the lowest mortality rate, or in other words, the highest infant survival rate. Thank you for watching. For more information on healthcare or any of our other topics, please contact the Director of Social Programming, Dawn Gagno, at 916-912-3688 or at dgagnocdic@gmail.com. Thank you.